Dr. Thomas again. I'm here to talk to you today about heartworm disease, which affects dogs and cats. This is a really gross picture of what actual heartworms look like in the heart of a dog, which is a real picture. Worms that live in the heart cause deadly disease in dogs, and unfortunately in South Carolina we have a high incidence of heartworm disease, with over 100 new cases reported by veterinarians to the state vet's office every month. Infected dogs transmit this disease to other people's dogs. Mosquitoes are the carriers of heartworm eggs, so when they go to take a blood meal from a dog, they inject those eggs into the dog's bloodstream. Over time, these eggs become adults and they live in the heart and lungs where they reproduce internally. By giving your dog oral or injectable heartworm prevention, we're killing the eggs and most of the larval stages of heartworms, which prevents them from becoming adults that live in the heart and in the lungs and damage that tissue. Unfortunately, for dogs that are not on prevention and become infected with adult worms, the only treatment is a series of very costly injections, and those injections will kill the worms, but then they have the ability to clog up vessels and cause heart failure and death. Veterinarians will require annual heartworm testing for all dogs to make sure that we can identify heartworm positive animals so that they don't infect other dogs. A common question is, why do we test dogs that have been on preventative medication? And the answer to that is because not all preventatives are 100% effective. We know that the oral medications that are given once a month or every 3 months may not be digested fully. They might be vomited. If your pet didn't eat the treat or the treat wasn't digested appropriately, then your pet may not have received the heartworm protection that we expected from that medication. Most dog owners are very aware of the life-threatening effects of heartworm disease and keep their pets on prevention all year round as recommended. They also understand that their pet can be a carrier of this infectious disease and give it to other people's pets. So we have a social responsibility to make sure that if we're pet owners, that we're doing what we can to not only protect our pets, but other people's pets as well. Thank you for helping us to help you to prevent this disease in dogs that can be deadly and devastating to families. We appreciate your help.